Talk about chronic constipation. I'm board certified in Oriental medicine. I've been treating patients with complex and chronic illnesses for more than 15 years, and most of them have some kind of tummy problem. I'm going to give you the short version first, and then we'll go deeper in case you like knowing all the messy details. Don't take stimulant laxatives. Rhubarb, cascara, senna, and aloe can be used under professional supervision as a rescue, but they should not be used for long periods of time because they can mess with your normal healthy flora and create dependency. And I cannot tell you how many patients I have seen have better poops after they stopped using supplements like this one and started drinking more warm water, doing abdominal self-massage, and eating healthy diet. With abdominal self-massage, go until you pass gas. Go for a short walk after every meal. And if you're still not going, you may need some kind of medicine, but usually not a prescription and hopefully not a surgery. Let's dive deeper now. Most GI docs will tell you if you're having 3 bowel movements a week, you're not constipated. I disagree. You should be having 1 to 3 Bristol number 4s a day, and if they feel incomplete or you have to push, you're constipated. Intestinal motility, the worm-like squeezing of your innards that moves everything around from mouth to butthole, is governed by a gas called nitric oxide, and most of that is produced by your intestinal flora. And nitric oxide has to be in a Goldilocks zone sweet spot to work. Too much will create a lack of motility. So will too little. Clinically speaking, most patients are in the too much category, so we're going to focus our efforts there today. Chronically elevated levels of nitric oxide can basically burn out the endings of the motor nerves of your intestines and slow them down. This is similar to the inflammatory effect seen in the nerves of the feet and brains of people with diabetic neuropathy, and just like that, it tracks with other chronic inflammatory factors like elevated homocysteine. If you have chronic inflammation and your brain is kind of foggy, there's a good chance that the nerves of your gut are also under attack. And the same is true in dysautonomia. The keys to healing this, aside from the things I mentioned at the beginning of this video, are in cultivating a healthy microbiome, because those nerves can grow back, and your microbiome is in charge of whether or not that's going to happen. There are specific plant medicines that can help you get there. Citrus has been used in traditional Chinese medicine for thousands of years to safely speed up sluggish bowels, and has even been shown to be effective at improving bowel transit in patients with spinal cord injury. Koik seeds are prebiotic powerhouses for promoting the growth of lactobacillus and bifidobacter, which play a very large role in intestinal motility. And acarus is the main herb we use to trigger nerve regrowth. As always, talk with your doctor before starting any new herb or supplement, but I hope you take home from this that help is available.